everybody, my name is Aishwarya. Welcome to the new episode of Dr. Abdullah's Clinic. Today we are here to discuss mainly about gastric issues, or which is also called as GERD. Have you ever wondered why you have issues which may be related to acid reflux, or maybe you have food and suddenly it comes back into your mouth, or maybe even chest pain? Well, we have our very own general practitioner, Dr. Nabila, who's going to brief us about what exactly are the symptoms, how can we avoid them, and how to have a better lifestyle in order to ensure that we live a better life. Over to Dr. Nabila.
I'm Dr. Nabila Khalid, working as a general practitioner in Dr. Abdullah's clinic. I'm here to talk about the most commonly faced problem by all the youngsters and elderly, that is GERD, or Gastroesophageal Reflux disease, commonly known as gastritis. Now, what is GERD or Gastroesophageal Reflux disease? Gastroesophageal reflux disease is a chronic disease. It occurs when the contents from the stomach flow back into the food pipe or the esophagus. It occurs mainly due to the failure of the muscle valve, that is lower esophageal sphincter, that is located at the end of the esophagus, that is between the stomach and the esophagus. Having this once in a while is very common, but if you are going to experience it twice or more in a week, that means that you are experiencing GERD. What are the symptoms of GERD? The most common symptom is heartburn. It occurs due to the irritation of the lining of the esophagus due to the backwash of the stomach content. The irritation can reach up to the neck or the throat and also causes other symptoms. There can be difficulty in swallowing, there can be dry cough, bad breath, bitter taste or sour taste, chest pain, nausea. GERD can be avoided by making some lifestyle changes. Some of the tips are: make sure that you take food on time, especially do not skip the breakfast, and also see that your evening meals to make it by 7 to 9, and do not go to bed soon after taking your dinner. At least there should be a gap of 2 hours before going to the bed. Next is, do not drink water between the meals. What happens is that if you drink water, the food remains in the stomach and that causes delayed gastric emptying, and when you lie down, the regurgitation occurs. See that you drink the water half an hour before meals, or at least 1.5 after the meals. Now, what foods to be avoided in GERD? There are some trigger foods like chocolates, citrus fruits and juices, coffee, then comes the carbonated drinks like Pepsi, Cokes, then spicy food or oily foods. All these causes GERD. Now, what are the foods that can be included in your diet to reduce GERD? It includes cold yogurt with less sour, and you can also have buttermilk at the end of the meal. Then you can have non-citrus foods and juices. See that you fill only half your stomach in the night. The next is quit smoking, alcohol, try to reduce your weight. Next is sleeping with elevated head position, that is by keeping 4 to 6 pillows. So even after doing all the lifestyle modification, even if the symptoms persist still, you have to consult the doctor for the proper treatment. And the treatment part includes antacids like Gelusil, which is a commonly available medicine, then H2 blockers like ranitidine, famotidine, nizatidine, etc. Then the proton pump inhibitors or the PPIs that include omeprazole, pantoprazole, esomeprazole, etc., which has got no side effects. Also see that if you are a renal patient, do not take these medicines for long term.
Thank you, Dr. Nabila. Hope everyone found today's episode very much insightful. We have a lot of issues going on in life, but to make changes in our lifestyle is something that we should prioritize and make it mandatory. Until we see for a new episode, this is Aishwarya here signing off. Thank you everyone. Take care.